Good morning, viewers. My name is Dr. Digol Moses Dogbache. Today we are going to look at infertility in a couple. We have primary infertility and a secondary infertility. The primary infertility is a couple who have been married and staying in the same room, sleeping on the same bed every night for a whole 1 year without conception. That is a primary infertility. Now, a secondary infertility is a couple who have been together for some time and they have a previous child, and then looking for a second child. It's taking a long time for them to conceive again. That is a secondary infertility. Now, the causes of infertility include a wide range of physical as well as emotional factors. Approximately 30 to 40% of all infertility is due to a male factor, such as retrograde ejaculation, impotence, hormone deficiency, environmental pollutants, scarring from sexually transmitted disease, or decreased sperm count or low sperm count. Some factors affecting sperm count are heavy marijuana use or use of prescription drugs such as cimetidine and nitrofurantoin. The other cause of infertility is also a female factor, also scarring from previous sexually transmitted disease or a disease called endometriosis, or there's a ovulation dysfunction or poor nutrition or hormone imbalance or ovarian cyst or any pelvic infection or pelvic tumor, or there's a transport abnormality from the cervix to the fallopian tubes. And this is responsible for about 40 to 50% of infertility in couples. The remaining 10 to 30% of infertility cases may be caused by contributing factors from both male and the female, or the cause may not be known at all. It is estimated that 10 to 20% of couples will be unable to conceive after a year of trying to become pregnant. It is important that pregnancy be attempted for at least a year before you declare yourself that you have a case of infertility. The chances of pregnancy occurring in healthy couples who are both under the age of 30 years and having intercourse regularly is usually between 25 to 30% per month. A woman's peak fertility occurs in her early 20s. As a woman goes beyond 35 years, particularly at 40 years, the likelihood of getting pregnant drops to less than 10% per month. In addition to age-related factors, increased risk for infertility is associated with the following: multiple sexual partners. This increases the risk for sexually transmitted diseases, and a history of pelvic inflammatory disease, or a history of orchitis or epididymitis. These are conditions affecting the testes and then the epididymis in men, or men who had previously had mumps before, or men who have varicocele. And then eating disorders in women, for instance, can also lead to infertility. And we have something called anovulatory cycles in females. You know, when every month a woman needs to have something called ovulation. At the beginning of menses, the uterus lining is worn out, and then at the same time the ovaries start developing. And after some period of time, let's say the person has 4-day ovulation period, then around 14 days from the day you started having the menstruation, the eggs get matured and then released. That's what we call ovulation. But some women don't have ovulation, so the egg doesn't get out, so it can never get fertilized. That will lead to infertility. And then there's also like defects of the uterus, like a fibroid in the uterus can also lead to infertility. And long-term diseases like chronic illness like diabetes can also lead to infertility. Now, what symptoms do we see? The person is unable to get pregnant, and there's a range of emotional reaction either by both the partners. The partners may be fighting all the time, especially if they don't have any child at all. They may be blaming each other for the problem. Now, what do we do when we come to Medimoses clinic? What we do is that we take a complete history and we do a physical examination of both partners, and we do some tests. We do semen analysis, which is very important. We do semen analysis. We also encourage the patients to check their ovulation period carefully. We teach them how to do the ovulation period. And then we do hormonal analysis. We check the serum for the progesterone level, for other hormones that are related to the woman functioning well, like the follicle stimulating hormone, luteinizing hormone. And then we also request for what we call histosapingogram. This is an X-ray of the fallopian, of the uterus and then the fallopian tubes to see whether the tubes are patent. And the other thing you can also do is to do laparoscopy. That is to look at the uterus and then the fallopian tubes directly. Now, treatment is for both couple. We look at both couple and then treat the cause. If the cause is coming from the man, we treat the man. If the cause is coming from the woman, we treat the woman. And the treatment depends on the cause. As I said, simple education and counseling works. Medicines to treat infections or promote ovulation, we have it. And then appropriate therapy is given. And this allows for pregnancy to occur in about 50 to 60% of previously infertile couples. We at Medimoses Clinic and Herbal Center, we make sure the couples are properly treated within a reasonable period of time to achieve conception. Thank you.